Hello, this is Dr. Do again. This video is alphabetic list of problems on letter G. Today I'm not going to talk about individual problems, but I just like to talk about one of the important chemicals produced by the body plays so important role in so many conditions, and it's kind of mysterious because the function of this chemicals is really in multiple, and so what is it? Is a glucocorticoid, and associated with it is the mineralocorticoid. So is any conditions that associated with this glucocorticoid need to visit emergency? Actually, it's not directly of too much or too less glucocorticoid warrant emergency, but it is another group of chemicals, adrenaline, because they produce in the same organ, adrenal gland. So if not enough of glucocorticoid, probably indicates there's not enough adrenaline. That is the emergency situation, because could has very low blood pressure, arrhythmia, and also in the shock condition of shock. So that is the emergency. In terms of glucocorticoid or mineralocorticoid itself, usually not associated with emergency, like I said, but adrenaline deficiency or not enough, that is the emergency. So if it is acute. So this is about, so what are the, before I talk about what are the glucocorticoid or mineralocorticoid, let me just briefly introduce about the adrenal gland. I think I have talked about this when I talk about Addison disease, which is the condition of adrenal gland hypofunction. But I did not talk details about the adrenal gland. So adrenal gland are the two organs sitting on the kidney. In terms of the characteristic of this organ, it's not very solid as liver or as spleen or as kidney, and also it's not very fragile like a pancreas. So it's in between. It's not very soft. It's not very spongy. In between of this kind of truly solid, or like a pancreas truly spongy, in between of this. And it has the cortex and also the medulla secrete different chemicals, like the center of medulla, really that's where adrenaline produced, epinephrine, norepinephrine. So this is, and we know epinephrine and norepinephrine are the hormones. They also they're the neurotransmitters. So that's why the adrenal gland is called neuroendocrine organ. So it's just in between the neurotransmitter and also the hormone, because adrenaline it really can do both. And the peripheral or cortex have different zones and secret different kind of steroid. That's where steroid produced. So the outer layer produce the glucocorticoid. Actually, the outer layer is mineralocorticoid, which is aldosterone. I'm going to talk about what aldosterone do, and then at the middle are the glucocorticoid, and in the center around the medulla, that's where the testosterone produced. So this is about the briefly introduction of this adrenal gland. So what does the aldosterone do? Aldosterone is a hormone that is very important to regulate the sodium potassium metabolism, maintain the homeostasis of these two electrolytes. So if aldosterone is produced, the kidney reabsorb potassium and get rid of for exchanging of get rid of sodium, so exchanging potassium to preserve potassium and get rid of extra sodium. So that's one of the aldosterone's function. So if this aldosterone is not normal, then usually associated with the potassium, either aldosterone too much, then the potassium will be too high. If aldosterone is not enough, then probably lose potassium. So this is a very important hormone and also associated with blood pressure. If the sodium cannot excrete, then dragging water stay in the body, water retention, so that's also cause hypertension. So this is the aldosterone. Let's back to the topic of this video, glucocorticoid. So this glucocorticoid is regulated by the pituitary and the hypothalamus. So this belongs to the axis of the endocrine. And this glucocorticoid has a very broad variety of functions. Anti-inflammation is the major one, and also can inhibit immune function. At the same time, it can have the anti-inflammation function. So this is kind of sounds kind of antagonist each other, but actually it's not. So that's why the glucocorticoid used in many situations, like the autoimmune disease and also in the inflammation disease. They both sometimes pair each other. So that's why I use a glucocorticoid. And also some very strange function. For example, the viral caused encephalitis, because the brain might undergo the swelling, and that's the time use the glucocorticoid could be very effective to decrease this swelling, inflammation. And on the other hand, if the immune function is too strong, for example, the post organ transplant usually can use the steroid if the autoimmune reaction is too strong, or the allergies, or other autoimmune disease like lupus or rheumatoid arthritis, etc. So this steroid also not only anti-inflammation, also to balance the immune function. So this is the mysteric steroid, glucocorticoid, and again it is regulated by the pituitary and also the hypothalamus, either from the signal of the body, whether the adrenal gland is secreting too much or not enough of this glucocorticoid. So this is very touch basis, very basic, superficial about this introduction. The purpose for this video is you probably heard this steroid, glucocorticoid, but you probably just not dig or search more information about it. So the purpose for this video is just if you had experience using this kind of medication, you probably want to search more and to protect from the side effect and protect from overtaken, or follow the advice from the physician, compliant with the physician's prescription. So that's the purpose for this video. Thank you for watching. I will see you next time.